Hello, I'm Dr. Donna. We're going to go over the cardiovascular system, and we're going to start with the heart. We're going to talk about important things, the essential things to know. Many nursing students and nurses have a fear of the cardiac system. Learning the basics will benefit you no matter where you land in your career. The cardiovascular system is comprised of the heart and the blood vessels. What is the main purpose? Perfusion. To ensure life by providing oxygenation and nutrients to all the cells, the tissues, and the organs. That's that beautiful pump. So we're going to talk about the layers, the chambers, the valves. As you can see, the circulation. These are wonderful pictures. We'll talk about the blood flow throughout the heart and the rate electrical system, a little bit about the plumbing, and we're going to have a review session to help you do some critical thinking as to why you might need to know these essentials. The heart pump and vessels are protected by special layers, just like a coat with a lining, a fibrous outside layer or pericardium, and a serous pericardium. So it's a two-sided layer with 20 to 30 milliliters of lubricating fluid between to prevent friction. So the first layer produces the fluid and it's firmly attached to the fibrous layer. The space between is called the pericardial space. The second layer is in direct contact with the heart itself. I know that medical terminology has probably been a while ago for many of you, but if you become a wordsmith, it's really going to help you in your career to understand a lot about how you look at some of our words and our terminology. Let's look at the word or the piece of word, peri, P-E-R-I. That is surrounding, about, around, enclosing. So when you think of the pericardial sac, cardi being heart, that sac that's surrounding the heart. Epi or epicardium is upon or on top, the exterior heart layer, the outermost tissue layer. And then you have the myo. Myo means, as this dear guy is showing you, muscle. Myo is muscle fiber, and it's myocardium, the heart muscle middle layer. It's responsible for that pumping action. Endo is the internal most layer. It lines the inside of the heart and also the valves. Why would that be important? When you later on learn about endocarditis, you understand that that inflammation, itis, is inflammation. Endocarditis can involve not just the heart, but also the valves because it's that inside lining. Having meaning to what we're learning is so important because you're going to know more if you remember the things that we're going over. Your heart is a hollow organ with muscular wall, and it has a septum or a division wall between. We always look at the heart and we say it's right and left chambers, each with a top and a bottom chamber, the top being atria or atrium and the bottom being your ventricles. Blood travels through the heart pump. It's on a life-saving mission. It is going to distribute oxygen from the lungs, the oxygen distribution center, and it's going to disseminate that oxygen and nutrients to all your cells and your tissues and all your organs throughout your whole entire body. Oftentimes you're going to see a picture of the heart and it's just going to show you the great vessels, and it's not going to show you the entirety like these pictures are showing you. It's an amazing thing. We've got the top chambers as your atria. You have 4 valves within the heart, And you need to know that is pulmonary, mitral, tricuspid, aortic valves, 4 valves. And here is a very key point. Unidirectional, uni meaning one way. You've been on a one-way road. If you see someone going the wrong way, you know it's not a good thing. So your blood flow is unidirectional throughout your body, throughout your heart. It should only go one way. Let's talk a bit about the journey that your blood takes. It begins with the right atrium when all your unoxygenated blood dumps into that right top chamber. What all's dumping in? You have blood coming from the inferior vena cava, the superior vena cava, and the coronary sinus. What in the world is that? People often don't realize that the heart pump has arteries and veins as well, and the coronary sinus is the unoxygenated blood coming back to the right heart. The right heart is the unoxygenated area. So we have this dumping in to the right atrium. You have a valve between the right atrium and the right ventricle. It is a 3-leafed valve. So when I say to you, it is the tricuspid valve, that makes sense. 3 tri makes very good sense when you know what that word means. And I actually changed tricuspid valve to trite, T-R-I-G-H-T, cuspid valve. And the reason I did that is so that you will always remember the tricuspid valve is on the right. And it is 3-leafed and it opens like a door. It receives about 70 to 80% of your blood volume. Now, when your top chambers actually squeeze at the end of their cycle of contraction, they squeeze in another 20 to 30% into that right ventricle and the left ventricle as well. And when that top chamber squeezes it all out, it's called atrial kick. And I want you to remember that because that's adding to the volume of your blood and your heart. 20 to 30% comes from the squeeze of that atria. And in some arrhythmias, that atrial kick is lost, which means you have less volume in that heart pump. Memory moment, tricuspid valve is the AV valve on the right side. The next step says that blood is flying through that poor little darling heart. It is closing and opening of doors or valves. So one valve closes while another opens up. When the tricuspid valve closes, the one leading to the lungs, the pulmonary system, the pulmonic valve, opens as blood heads to the lungs. Unoxygenated blood needs to go to the distribution center to get that wonderful blood oxygen connect. Now, in your anatomy and physiology classes, you have always been told that arteries carry oxygenated blood, and arteries go to target organs. There's always an exception to every rule. You see, your pulmonary artery that's going toward the lungs is carrying oxygen-poor blood. And then the veins will dump into the left side of the heart, and those pulmonic veins are going to have oxygen rich. They are the only exception to the rule that arteries are oxygen rich, veins are oxygen poor. They're the only ones that are different. So the pulmonary system is the only one in the body that actually switched that up. Pulmonary artery, oxygen poor, pulmonary veins, oxygen rich, and they dump into the left ventricle. Now the left side, how do you remember the valve between the left atrium and the left ventricle? It is the mitral valve, left. Mitral left. So the mitral valve is on the left between your atrium and your left ventricle. What's the difference between the right and left ventricle? Your left ventricle is much thicker and more muscular. It is your powerhouse wall. Why? Because it's pushing against resistance. It's pushing against your arterial system, which is a high pressure system. So your heart chambers can squeeze and they can relax. Different ones call it differently. I don't care how you call it. If you want to remember it as squeezing and filling, that's fine. Squeezing and filling. It's perfect. Contraction, relaxation. That's all right too. But the terms that we usually use are systole and diastole. The systole is the squeezing, diastole, the relaxation. One amazing thing to know is during diastole is when your heart gets fed. During the filling is when the coronary arteries on the outside of that heart actually fill and feed and nourish the heart pump. And as far as flow dynamics, in the event that you have a problem with the valves, that maybe they don't close like they should, or they don't open like they should, maybe they're stiff, maybe they're leaky, maybe they were created with less leaflets than what they should have. If you have a valve malfunction, you may not have unidirectional flow. You may have what is called regurgitation or turbulence. And when we go into assessments, you're going to understand that when that happens, that back and forth flow, that turbulent flow, you're going to hear different heart sounds than you normally would. Often our nursing education categorizes everything into teaching systems. We'll teach you about the heart, we'll teach you about the lungs, we'll categorize it, we'll cut it off. But you need to realize that when it comes to cardiopulmonary circulation, it is the heart and the lungs, the pulmonic system, the circulatory system, and also the hematological system is also integrated. Whoa, what is that? Well, if you think about your red blood cells, they're like trucks that carry the oxygen. They have an affinity for oxygen. They like to connect. When they go to the lungs, they love to grab on to those oxygen molecules and help spread it all over. So these pictures illustrate the complexity of the systematic blood flow, and the vascular system is vitally important. As you can see, goes into the lungs as well as through the whole entire body. Gives you an excellent idea as to how important things are. And if you notice on the heart, it's showing you that the heart not only has coronary arteries, which sometimes we talk more about that, but the heart also has a venous system as well. And when the heart gets fed, that unoxygenated blood flows into the right atrium through the coronary sinus. And oftentimes people kind of skip that, but this gives you a really good visual. The smallest, most numerous of vessels are your capillary beds. And when we go through fluid and electrolytes in the venous system and go through all about our vessels, we'll cover that. The capillary beds is where you have that marvelous exchange of nutrients, waters, gases, CO2, O2, waste products between the tissues and the blood. And we have layers within the veins and the arteries. The veins are thin-walled, and I'm sure that you know they have valves. If you've ever done anything with IV therapy or you've tried to cannulate someone's vessel and you're like, oh my, oh, I hit a valve. There are valves in the arms and the legs, and that helps with what we call venous return, that unoxygenated blood on the venous side heading back towards the heart. So your valves are going to help to push the blood back to the heart. And here are your 3 layers of your vessels. You have a tunica intima. Oh, intima. That is the inside layer, intimate with the blood cells and the plasma. It's the innermost layer. And the valves are in the veins as well. Tunica media, that's the middle muscle layer. You think about that and you think about, wow, that's why when you put a warm compress on someone's arm, you can vasodilate. That's also the layer that can actually constrict and shunt blood to different areas of your body. And also the adventitia layer is your outermost. And in your arteries, you have the same 3 layers. And the greatest thing about it is in your arteries, your adventitia layer is much more supportive because you've got so much more pressure on the arterial side. So you also need to know that blood is going to flow from an area of high to low pressure, arteries, capillaries, veins. When you think about how great it is that we have an internal pacemaker, it's called your sinoatrial node. It's an area of tissue in that right atrium, and we call it your inerrant pacemaker that you were born with. Your electrical system, I like to think of like dominoes. When we were kids, we would always stack up the dominoes like that, take our fingers, smack the dominoes, and down they would fly. And your pacemaker is kind of like that. You see, your electrical system of your heart is very much like your dominoes. The pacemaker in the right atrium will kick off the response, and the current will fly down the pathways of the heart saying, come on, cells, time to squeeze, guys. Your heart cells have the ability to have conductility. What is conductivity? It's the ability to transmit an electrical impulse from one muscle cell membrane to another and another and another, just like dominoes. Doot, 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 doot. Contractility is the heart muscle cells' ability to shorten and contract in response to that electrical stimulus. So what do we do and what do we use to evaluate the electrical system of the heart? We use an EKG. How's it work and what does it show? Well, when you put somebody on an EKG, you've got a conductive gel on these little electrodes that you put on your body. And the electrical current is transmitted to the body surface and then it goes on to a graphic or computerized display. It's really quite amazing. It will show you your heart rate, your rhythm, the regularity of the current that goes through the heart. And abnormalities can quickly be identified. What is normal heart rate? Normal heart rate is 60 to 100 beats per minute. If it is slow, it is Brady. Brady means slow or delayed. If it's tachy or tachycardic, it is rapid. Now, when you see the letter A before words, it usually means absence of, or not, or without, or abnormal. So arrhythmia is what? An abnormal rhythm. Just like when you think of anemia, A-N, it is a problem with your blood. Without blood. Anoxia, A-N, without oxygen. Do you see how wonderful it is to be a little bit of a wordsmith and have an understanding that, yeah, we can do some of this terminology and put it in your head exactly what these words mean, and it's going to help you have a better understanding being a wordsmith. Cardiac output, what in the world is that? Cardiac output, well, you know, there's always output, whether it's an electrical system, whether it's lights. Cardiac output is actually the amount of your ventricular output or volume in liters per minute. Don't make this difficult. It is a math problem, or formula would be a better word. Your cardiac output equals stroke volume times heart rate. Wow, that sounds complicated, like ICU jargon, but you might as well know it now while we're talking about the heart. Stroke volume times heart rate. If the normal amount that your body pumps is 4 to 8 liters, how many milliliters are in a liter? 1,000. If your heart rate is 70, and you usually, with every amount of blood ejected, that would be your stroke volume. Let's say that is 50 to 100 mils is with every squeeze of your heart. That's how much volume is being squeezed out. That is your stroke volume, the amount of blood ejected by your heart with every beat. Let's make this easy math. Let's say you've got 100 mils of output with every squeeze. Your stroke volume is 100, your heart rate is 70. You do that multiplication and you end up with 7,000 mils or 7 liters. And then you say, well, what's normal cardiac output? 4 to 8 liters a minute. Well, you're pretty normal. Cardiac output is stroke volume times heart rate. The normal cardiac output is 4 to 8 liters. How many mils in a liter? 1,000 mils in 1 liter. How much stroke volume? And what is it? The amount of blood ejected by the heart with every squeeze. And normal amounts are 50 to 100 mils per squeeze. It's nice to know, isn't it? When you know what cardiac output is, and you think of things that could potentially create a problem that would reduce that cardiac output, what would you use your imagination and think? I could have reduced cardiac output if I'm hemorrhaging because I've lost volume. I could have reduced cardiac output if my heart pump is pumping so fast I don't have time to fill, which would reduce my stroke volume, which would reduce my output, and that increased heart rate will reduce the amount of output my poor heart would be able to have. Do you see how important it is to have meaning behind what you learn? Because then you can understand complications, because you're going to be the ones to see them. So you might as well know now what you're dealing with. You need to know essentials. When you think about blood flow and you think about perfusion, I think I've already told you this. When does your heart pump get fed? When is it getting fed with oxygen and nutrients? And what about its venous system? These pictures are beautiful because it shows you've got coronary arteries and veins. And oftentimes, I think this is left out, that you do deliver O2 to that heart muscle, and you also get that unoxygenated blood back to the right side of the heart to go get oxygen. So what do you need to know? The heart is fed during filling. Fed during filling. It is fed during diastole, when the heart is filling the coronary arteries. It is perfusing the heart pump, and the coronary circulation arises off the aorta, and the branches of the arteries feed specific areas of the heart, as you can see. Some are going to do the anterior side. You know, Christopher Columbus thought the world was flat. A lot of times when you look at commercials, you think that the heart is flat as well, and it's not. You see a man mowing, and he's mowing, and he's grabbing his left arm, and he's grabbing his chest, and yeah, that's maybe the signs and symptoms of an anterior wall MI, because you see your heart has different sides. It's got a front side, a back side, a bottom side. And what do we call them? It even has a division, right? The septum. So when you think about all these areas that blood flow feeds, you have an anterior, posterior, you got lateral sides, inferior underpart, septal area on the division between the right and the left ventricles and atrium. You know, you just go, wow. So the branches you're looking at actually feed specific areas of the heart. And when they're blocked, what happens? When you don't have oxygen, you're going to have pain. Whether you don't have oxygen to your feet, your legs, your heart, you're going to have pain when you don't have O2. And when in the heart are you going to have pain? When you have a problem with an artery flow, when you have plaque, when you have all kinds of issues with that arterial system. Signs and symptoms of heart issue and pain are going to be different depending on what vessel is feeding that area. It isn't always just going to be the left arm is hurt and the chest is hurt. You're going to find out when we go over the abnormals of what other symptoms can be presented depending on what artery is feeding which area of the heart. As we go forward, as I try to give you essentials, you can get lost in the weeds, but I want to give you essentials, and I want to provide for you so that you're thinking about the future topics that we're going to cover. I want you to have that critical thinking. There's some things that are nice to know, and there's some things that you need to know. So consider this. The amount of pericardial fluid, say about 30 mils, and the purpose is when the heart is pumping that you're not having a lot of rubbing and you're not having anything but lubrication. It's an easy thing. Do you believe a large amount of fluid can accumulate in that space? Why would it be nice to know that 30 mils is what it really should be? The answer is yes. You're going to find out. Pericardial tamponade, you can get as much as a liter of fluid in between that space where those layers that you learned about are. Imagine the compromised pumping action of that heart when you've got a huge amount of fluid not allowing that heart to fill and expand. Just put that in your critical thinking box, because you're going to learn about pericardial tamponade. If the heart muscle is fed during diastole or filling, can you imagine any situations when your heart is being cheated? In the event that heart rate is going 190 a minute, what do you think that's doing to the feeding of the heart and the filling? Are you having enough time to fill? When normal heart rate is what? 60 to 100 beats per minute. And what about Pressure. We're going to talk about blood pressure and hypertension. What if your diastolic blood pressure is extremely high and that's your filling time, and that's when your heart's supposed to be getting fed? And what if you have a high pressure resistance? Oh, something to think about. And what happens if your blood flow is not unidirectional? When we do assessments and you listen to heart sounds, you're going to wonder, something's not right. When the blood flow is not unidirectional, you are going to hear heart murmurs when you listen and auscultate that heart sound. You can have an incompetent valve. You can have heart failure. And remember, there are no valves at the atrium. Isn't that amazing? Everything is pouring into the atriums, right? There are no back check valves in the atriums. So what does that tell you? If there is backflow, right side's going to go to your body, left side's going to go to your lungs. It's going to go in the direction that it came from. That's why it's so nice to know. How is the flow pattern? What is the real normal flow pattern of blood? And then you're going to understand when it backs up, why it backs up, and where it's going to go. Because if you know the flow, you're going to know when it's backwards. Whoa, wait a minute, I know where you're heading. What problems can occur with the hematological system that would create an issue for the cardiac pulmonary system? Think about that. If your red blood cells are transporting your oxygen and your nutrients like trucks and you don't have enough trucks, what happens? What if you don't have enough volume? What if you're bleeding? Poor volume, hypovolemia, blood loss, anemia, not enough red blood cells, not enough hemoglobin, because hemoglobin is the one that's in love with oxygen. You're going to learn all these things. Are there times the electrical system of the heart will create a problem? You know that I think that's one reason why a lot of nurses and nursing students are afraid of the heart, because they know it can stop. They know that rhythms can create a life-threatening event. And in all honesty, once you learn to discern your rhythms, once you learn how to assess your cardiac system and your pulmonary system, and you begin to put these pieces together, it's going to take fear away, because you're going to replace your fear with competence. So when you learn normal, you're going to know abnormal. So thank you for your time, and we will get on with the next session. Appreciate it.